Restricted charts is a feature that requires a two-step process to restrict access to a patient's chart by allowing only assigned providers and clinical staff members to access sensitive areas of a patient's chart. Only a system admin can enable the chart access restriction feature. To access chart access settings, hover over the user icon and click on Practice Settings. Click Clinical to expand the additional setting options. Then, click Chart Access. Next, select the checkbox to enable the chart access restrictions option. Depending on the needs of the practice, the system admin can choose which level of privacy to enable. Restrict access to clinical notes only. This allows staff to restrict access to the patient's clinical notes. When access is restricted, the patient's clinical notes will only be accessible to assigned clinical staff members. Restrict access to clinical data. This allows staff to restrict access to all of the patient's clinical data such as vitals, notes, medication, etc. When access is restricted, the patient's clinical data will only be accessible to assigned clinical staff members. For this training, we will review how to restrict access to clinical notes. Click the desired option. If applicable, click to select Automatically Add Clinical Admins to all restricted charts. This option automatically assigns system admins with a provider or clinical assistant role to all restricted patient charts. Then click Save. It opens the Enable Chart Restrictions pop-up window. To confirm, click Enable. Now, the chart access restriction is enabled with the status confirmation message on the site. The first step is now complete. Chart access restrictions can be disabled at any time. Uncheck the Enable Chart Access Restrictions checkbox. Then, click Save. When the Disable Chart Restrictions pop-up window opens, click Disable to confirm. Now, the chart access restriction is turned off. Note, if chart access is enabled again, all previously restricted charts will be restored. For the second step, only a system admin, provider, or office staff can manually restrict a patient chart and assign clinical staff members to access the restricted area of the patient's chart. This action has to be done manually for each desired patient. Restricted charts is to protect the patient's privacy by restricting who can access sensitive areas of the patient's chart. Enter the first 2 to 3 letters of the patient's name or date of birth in the search box. Then, click to select the patient from the auto-populated results to open the patient's face sheet. The patient chart shows as unrestricted when all clinical staff and providers have access. Now, click the unrestricted link. Click to select Restricted to display the staff name search box. Note, if a provider is restricting access, their name will automatically be pre-populated on the list. To assign providers and/or clinical staff to access the restricted area of the patient chart, click on the field to populate the name list of the practice. In this example, we want to add a clinical assistant, Mary Lee. Repeat this step as needed to assign additional staff members. When finished, click Save. The status of the patient chart is updated to restricted. In this example, only the provider, Kathy Shaw, and the clinical assistant, Mary Lee, can access and create clinical notes and treatment plans. Once the chart is restricted to the assigned users, it will give an alert message to the unassigned users when they click the restricted link. Now, let's learn how to unrestrict the patient chart to allow all clinical staff to access the restricted area of the patient's chart. Note, this action also has to be done manually for each desired patient that was restricted previously. Click Restricted to open the chart access pop-up window. Then, click Unrestricted. When finished, click Save. The status of the patient chart has been updated to unrestricted, and the staff can access the patient chart based on their user role's permission. The whole restriction process is now completed. These steps are also applicable when you are restricting view on clinical data for the assigned users. Now, let's take a look at how the patient clinical notes and clinical data displays for assigned or unassigned clinical staff such as providers and clinical assistants. To recap, the view of the patient clinical notes versus clinical data are based on the option that you chose at the chart access settings level. Based on the selected option, it determines what information will be accessible to the assigned providers or clinical staffs. When you select restriction to the clinical notes only at the chart access settings, it controls who can access the sensitive areas of the patient chart. For example, if a clinical assistant, Mary, was not assigned to review a patient's restricted clinical notes, Mary will not be able to access or create treatment plans and clinical notes. Mary will only be able to view and create non-clinical notes such as office forms or memo. On the contrary, if Mary was assigned a restricted view by the system admin, provider, or office staff manually for the specific patient, in this case, Diana, then Mary will be able to access and create treatment plans and clinical notes for Diana. Next, let's review how it looks when you enable restriction access to clinical data only. For example, if the clinical assistant, Mary, was not assigned to review a restricted patient's clinical data, Mary will only be able to access the patient's demographics and accounts. All other tabs containing clinical data will be hidden. If the provider, system admin, or office staff assigns restricted view manually to Mary for this patient, Diana, then Mary will be able to access all Diana's clinical data. With chart access setting enabled, it restricts access to a patient's chart by allowing only assigned providers and clinical staff members to access sensitive areas of a patient's chart.